Assalamu alaikum. Welcome to another episode of program Pharmacist Talks, a program in which we talk about medicines and how best to use them safely and effectively. I'm your host, Dr. Ejaz Cheema, and today we are going to talk about sleeping pills. Sleeping pills, often known as sedatives or hypnotics, are a type of medications that can help you go to sleep if you're struggling with sleeping issues. Sleeping pills can be purchased without prescription in the pharmacies, such as some anti-allergy medications, and also some of them are prescription-only medications. So if your best attempts to have a good sleep have failed and you're struggling with sleeping issues, then sleeping pills can give you a temporary solution. So here's some advice on how best to use them safely. First of all, you need to get yourself medically evaluated by your prescriber or doctor before you think about taking the pills, because your doctor prescriber can find out the causes that are contributing towards your lack of sleep. If you're pregnant or breastfeeding or elderly or have some other medical conditions such as kidney disease or low blood pressure or epilepsy, then you are not eligible for taking these pills because they can worsen your condition. Number two is that before you take your pills, it's important to look at the patient information leaflet, because that can educate you on how best to use them and how often to use them, and also what are the possible side effects of these sleeping pills. So thirdly, only take your sleeping pills before going to bed, because sleeping pills can make you less aware of what you're doing, exposing you to various danger situations. Number four is watch for the side effects. Sleeping pills can have various side effects, including severe allergic reactions, drowsiness, diarrhea, sleepwalking, sleep driving, hallucinations, lack of memory, and suicidal thoughts. If you're feeling dizzy during the daytime or it's affecting your day-to-day operations, then it's important to go back to your doctor or prescriber so that they can alter the dose or perhaps suggest you an alternative for the sleeping pills. The sleeping pills should not be taken with alcohol, because even a small amount of alcohol can make you drowsy and can make you faint, and even the alcohol itself can be a cause of your sleeping issues. If you are taking any pain relieving medications such as morphine or oxycodone or fentanyl, remember, don't take your sleeping pills with these strong pain relievers, also known as opioids, because the combined effect of opioids with sleeping pills can expose you to the side effects of sleeping pills, such as slow breathing or unresponsiveness, and also can make you stop breathing. So it's important to avoid taking your opioids with sleeping pills. Seventh advice is that only take your sleeping pills as per strict advice of your healthcare provider or the doctor, because the excessive amount of these pills or going against the instructions of the prescriber can expose you to the long-term effects of sleeping pills and make you dependent on these pills, and you become addicted to these pills. So it's important to only use them strictly as per the instructions of your healthcare provider. And last but not the least is that when you have decided to quit them, you have to quit them carefully and gradually, because an abrupt stoppage of these pills can give you withdrawal effects, and it's important to stop them gradually as per the instructions of your healthcare provider. Remember that sleeping pills are only a short-term solution and they do not provide a long-term solution. I hope that these pieces of advice are helpful for you. Please do share these with your friends and colleagues and family members, and keep watching program Pharmacist Talks. Thank you for listening.